Okay, well, welcome back to the endocrine system, part 5, I believe, at this point. I want to talk to you a little bit about anabolic androgenic steroids, and we're going to slowly start transitioning into the reproductive systems. So you probably are all familiar with what like steroids, right, are. So the full ones that we think about with weightlifters, or those guys that are just way too big to be natural. Those will be these anabolic, so referring to muscle building. Androgenic refers to increased male sexual characteristics, and then steroids just refers to a class of drugs. Some of you may have been put on steroids for, whatever medical condition. That does not necessarily mean that you can go to the gym and start pumping and suddenly look like one of them. Again, steroids are just a class of drug. They have to have these other two factors involved in order to get some of these effects. So let me just be very clear. The way that they will work on the body as well as the brain. It will be mediated by the binding to the androgen receptors as well as estrogen receptors on the surface of cells. And remember, both males and females have both hormones naturally occurring in their body. In general, males will have, or I should say your typical male will have much higher levels of testosterone than estrogen. And females will have the opposite, right? We'll have higher estrogen levels and much lower testosterone levels. Okay. Long-term use of steroids, these anabolic androgenic ones specifically, can have impacts on some of our brain pathways and chemicals, right? So these dopamine, serotonin, opioid systems, so they can definitely affect things like mood. So in this next slide, there are both preclinical, clinical, as well as anecdotal reports that suggest that chronic overuse of this class of steroids can contribute to certain psychiatric issues. So anywhere from things like irritability, delusions, really like impaired judgment. Again, because it's disrupting sort of the natural functioning of the brain. But not just that, prolonged use can lead to things like liver damage, jaundice due to liver damage, high blood pressure, increase in the bad cholesterol like the LDL. And it actually can be very tough on kidneys as well. I actually had a student many years ago now who was actually in renal failure at a very young age, like in his early 20s, due to past anabolic steroid use. And it can also, due to some of the hormonal influences, can cause severe acne. The effects will also be different for males versus females. One of the things that will occur in men is that their testicles will actually decrease in size as well as their sperm count. This is mostly due to the body thinking that it's producing plenty of testosterone because of what they're injecting into their bodies. So then I guess the testes don't have to make as much, right? So they actually will shrink. Sometimes individuals who do use these types of steroids will go off of them for a period of time so that their sperm counts go back to normal so they can conceive or help conceive children, and then they go back and continue use. Ironically, for men, it can cause the development of breasts, an increase in risk of prostate cancer, as well as baldness. In women, because these are androgenic, they start producing sort of male typical development. So you'll start seeing facial hair growth, you'll get male pattern baldness. It may disrupt the menstrual cycle. Because again, this androgenic effect, it can cause enlargement of the clitoris, deepening of the voice, depending on how early on in development. So like pre-teen years into teen years, they may start taking some of these steroids. It can have even greater effects, and we'll see that in a second. So in adolescence, it can cause stunted growth. There are a number of different issues it can cause in adolescence. It can cause inflammation in women in the reproductive tracts. So there's just a lot of complications that it can cause. It is not without the risks. that people who regularly inject these steroids, they run the risk of contracting or transmitting diseases, right, like hepatitis or HIV/AIDS, simply because people tend to get kind of cavalier about needle use. They don't necessarily clean it as well, or they can even get really nasty infections because they might reuse needles. And again, they might transmit some unfortunate, diseases, or again, some very bad infections. So I want to give you this example. So back in like the 70s, 60s, 70s, and then even in the early 80s, before East and West Germany became unified, East Germany was known for giving its female athletes very high levels of anabolic steroids. Now, the female athletes in that part of the country, well, I guess in that country, it was a separate country at the time, were not aware that they were being given steroids. They thought they were being given vitamins, and granted, they worked very hard on their athletic training. And let me back up too. In East Germany, like, to be an Olympic athlete was a state-sponsored event. Like, so if you showed any promise as a kid, the state would then take you, house you in sort of like a camp, and they would train you, right, in preparation for the Olympics. So if this video, it's about an hour long. I think it's a video called Secrets of the Dead. I think that's what it's called. And in this case, it's talking about the East Germany and the doping scandal and how it came to light. It's absolutely fantastic. I would highly recommend it. But here's a case of this one woman who, at a very young age, she did sort of like that track kind of stuff, where you throw the ball, or you throw the discus or the javelin, like those kind of like power moves. Well, East Germans, without her knowledge, gave her so much steroids that it changed her body into a very male-like physique until the point where she did not look female. As a casual observer, she herself was caught sort of in this very ambiguous gender identity until she finally decided to transition to male. That was the easiest sort of way that I'm not sure what pronouns they use, felt comfortable in their own bodies. But it's an interesting video. So again, you'll see how they will talk about like just their experience and some of the videos of them back when they were younger. And you'll get an idea of just kind of like that struggle. And again, they'll talk more about some other athletes and some of the things that they went through due to this doping that the government did when they were young. All right. I'm actually going to stop this video a little bit short because I think it makes more sense. Watch that video. You won't regret it. And then we'll come back on the intersection of hormones and the reproductive system.